The hip is the fulcrum of human performance, the gateway through which power is either transferred with precision or dissipated in wasted effort. Strength, speed, agility, none of these exist without the integrity of the hip. And yet, despite its undeniable importance, the hip is often misunderstood. Its mechanics reduced to oversimplified one dimensional thinking. Today, we strip away the guesswork. Whether you're a strength athlete, or a field sport competitor, or just a kinesiologist studying movement at its core, understanding the function of the hip in the real world is essential. To comprehend hip movement at its highest level, one must acknowledge the biomechanical supremacy of the hip. The hip joint is a ball and socket articulation designed to produce, absorb, and transfer force in multiple planes. Unlike the simple hinge of the knee, and not quite as mobile as the shoulder, the hip is both a generator of power and a stabilizer of human locomotion. The musculature of the hip is not merely a list of flexors, extensors, abductors, adductors, and rotators. It is an interconnected network, responding dynamically to joint position, external load, and movement demand, with some muscles even shifting their function depending on these variables. Make no mistake though, every elite athlete is in some capacity a product of hip efficiency. In almost every explosive movement, whether it's sprinting, kicking, rapidly changing direction, the hip flexors act first. The psoas major, originating from the transverse processes, vertebral bodies, and intervertebral discs of T12 through L5, is the only muscle that directly connects the spine to the femur. This is why a weak psoas compromises more than just hip flexion. It disrupts lumbar stability, postural integrity, and force transmission. The iliacus, originating from the iliac fossa, merges with the psoas before inserting onto the lesser trochanter of the femur, forming the iliopsoas, the most dominant hip flexor in high-speed movement. The rectus femoris, or rec fem, originates from the anterior-inferior iliac spine, or AIIS. It functions in both hip flexion and knee extension, but its biarticular nature introduces a concept called active tension and passive tension. When fully flexed at the hip, the rectus femoris is too short to effectively extend the knee. That's active insufficiency. Conversely, passive insufficiency occurs when the muscle is lengthened across both joints, in this case when the knee is flexed and the hip is extended. Force output is reduced in both scenarios, because there's not an optimal overlap of actin and myosin. Lastly, the tensor fascia lata, or TFL, originating from the anterior superior iliac crest, or ASIS, acts in flexion but also stabilizes lateral movement and impact absorption. Then we have the hip extensors, where a lot of athletic power originates as well. The gluteus maximus, originating from the posterior ilium, sacrum, and coccyx, inserts onto the gluteal tuberosity and iliotibial tract. It is the primary driver of hip extension, but its contribution varies depending on the movement. The hamstrings, including the biceps femoris, semitendinosus, and semimembranosus, span from the ischial tuberosity to the tibia and fibula. They contribute significantly to hip extension, with a caveat: the knee must remain extended, as in a stiff leg deadlift. When the knee is flexed, hamstring activation decreases relative to glute and adductor magnus activation when we're talking about hip extension, of course. This is due to a smaller length change in the hamstrings, probably the opposite of what you would expect given the nature of passive insufficiencies we discussed earlier. But let's put it this way: flexing the knee during a hinge pattern puts the hamstrings on slack, if you will, and their mechanical advantage is decreased relative to the glutes and adductors. Then we have the adductor magnus, particularly the posterior fibers. It is a significant but often overlooked contributor to hip extension, especially from deep flexion, probably due to its name. The external rotators, primarily the piriformis, obturator internus, obturator externus, superior and inferior gemelli, and quadratus femoris, originate from various aspects of the sacrum, ischium, and pubis, inserting onto the greater trochanter of the femur. These muscles resist internal collapse and enhance rotational control during unilateral stance and multidirectional movement. The internal rotators, including the gluteus minimus, portions of the gluteus medius, and the TFL, help fine-tune pelvic positioning and maintain alignment in dynamic motion. The adductors serve as both stabilizers and force producers depending on hip position. The adductor magnus, which you brought up before, with its anterior fibers originating from the pubis and its posterior fibers from the ischial tuberosity, is both a hip adductor and extensor. The adductor longus and brevis originate from the pubis, contribute to adduction and assist in hip flexion when the hip is extended. The gracilis, a biarticular muscle originating from the inferior pubic ramus and inserting onto the medial tibia, assists in both adduction and knee flexion, but it is susceptible to active and passive insufficiency like any other biarticular muscle. The hip abductors, primarily the gluteus medius, gluteus minimus, and TFL, are essential for lateral stability. The gluteus medius, originating from the ilium and inserting onto the greater trochanter of the femur, prevents the pelvis from dropping in single leg stances. The gluteus minimus, located beneath the medius, aids in abduction, but also contributes to internal rotation, while the TFL serves as an abductor that also plays a role in hip flexion. Understanding the hip musculature requires depth beyond what we have covered here. This has been a bird's eye view, if you will, but the nuances run pretty deep. The athlete who respects these intricacies moves with greater power, efficiency, and resilience. The kinesiologist who grasps these interactions can assess, correct, and refine movement at its core. Thank you for watching, and I hope that was helpful.